Hello, everyone. Thanks for joining us today. Welcome to Global Adaptation Month pop-up discussion series hosted by EcoAdapt's National Adaptation Forum team. Global Adaptation Month is an initiative aimed at advancing awareness, action, and accountability for the field of climate adaptation. We encourage you to visit www.globaladaptationmonth.org to learn more and to consider sharing a commitment about an existing or upcoming adaptation project. I'm Molly Johnson, one of the National Adaptation Forum organizers and coordinator of Global Adaptation Month, and I will be your moderator for today's discussion. Before we get started, I want to go through some housekeeping rules. This is intended to be a highly interactive conversation, so we encourage you to make use of the many meeting features available to us. You can use the chat box to share your thoughts with the group or message an organizer. Please also message an organizer if you have any technical issues you may be encountering. We will help you address any problems. You can also opt to share your webcam on the bottom left-hand side of your screen. We encourage you to use this feature, especially when you are sharing your thoughts with the group. Throughout the session, we will ask participants to share their thoughts. You can unmute yourself via the lower left-hand audio button, or when you are not speaking to the group, you can also use the chat box function. We will be recording and posting the session on the Climate Adaptation Knowledge Exchange website for future viewing, and the webinar should be available online next week and can be viewed at www.cakex.org. And I'm really pleased to introduce today's facilitators. We have Ken Mcloone, a senior staff scientist with ISET-International, and Mackenzie Dove, a scientist at National Center for Atmospheric Research. Thank you for being here, Ken and Mackenzie. And at this point, I'll pass it over to Ken to let him introduce himself and start us off. So thanks, Ken.
Ken Mcloone. I've been with ISET-International for like 12 years now. Prior to that, I was studying climate change. I was studying the atmospheric trace gases of methane, actually. And about 15 years ago, it became apparent we didn't really need a lot of work studying the science of climate change as much as we needed people to work on what are the impacts, how do we address them. So that's when I got involved in sort of international development work, and primarily on the area of resilience. So I joined ISET and have been doing various roles with ISET since, including largely focused on resilience. Mackenzie?
Thanks, Ken. Hi, everyone. I'm Mackenzie Dove. And first, thank you, Molly, for setting this up. And thank you all for being here today, which I hope will be a very interesting and engaging conversation. As Molly said, I'm with NCAR out here in Boulder, Colorado. I am specifically interested in governance systems and how they respond to risk. My research focuses on the translation and integration of climate-driven risk, and this has primarily been around heat. But those risks within governance structures and markets, I tend to focus more at a macro scale. And so looking at policies, legal frameworks, regulatory standards, investment strategies, different financing mechanisms that are supporting these structures, and how these frameworks can link within climate change adaptation and resilience efforts. Sometimes these can support or hinder the understanding and action around projected risks for different countries and different markets, and of course, impacts will affect different socioeconomic demographics differently. To date, I've primarily focused in sub-Saharan Africa and to a lesser extent in Southeast Asia. And I guess prior to my research career, I was working across sub-Sahara, primarily with the private sector. Back to you, Molly, Ken.
Yeah, sure. So one of the things to highlight again is that we're aiming for more of a conversation here. I know that climate and health as an area of focus is getting a lot more attention nowadays, particularly in in the health sector. There's a lot of discussion around climate. Health has a lot of meanings to a lot of different people, and that it can mean down to the individual, to public health, to issues like that. And the way we're framing today is much more around health systems and the impact of climate change on health systems. But of course, you know, we're having a health issue right now that everyone's quite aware of, and that's the COVID-19 outbreak. So, you know, we weren't necessarily going to touch or discuss COVID-19 per se, but at the same time, it's very present and obviously in our lives. There are definitely correlations that I see between the climate change impact on our systems and COVID-19, but I just wanted to touch on, you know, that obvious thing and see if by chance you know, anyone wanted to discuss that before we moved on to talking about other things. The old 8-second rule. So in general, we're going to talk about resilience, systems-based thinking, and just sort of the need for integration. And the idea is mostly to open up, you know, how people generally approach coming to an event like this is like a webinar. It's very much like a lecture or a panel discussion. And that's not our goal here. Our goal here is to sort of have a discussion with those involved. And Molly, I'm not sure if people can chat individually with one another rather than to the whole group, but I think as much as you can like chat with others or network, that would be great. And so, you know, part of a general resilience approach is sort of the informal knowledge networks that build around a subject. And that's part of what I was looking for in doing something like this was to promote and sort of build a platform where people could discuss an issue like this. Yeah, I got involved in resilience rather than adaptation, which is distinct in my mind because resilience is much more about looking at systems. And by systems, I took it from a sort of ecology academic perspective. By systems, I was meaning complex systems. So nested subsystems interacting with unknown outcomes because you couldn't predict such things, which is why resilience as opposed to adaptation was important to me. Adaptation, in my mind, was very much about understanding a specific impact on a specific project and over some period of time. And how could you address that? How would you adjust what you're doing to meet that? And in resilience thinking, it's much more about understanding the systems, their nonlinearities, and where there are gaps that you could potentially manage such that by some intervention you could enforce or take care of some of the weak spots. So that's much more of a general resilience approach. Mackenzie, did you want to talk about health systems?
Sure, and I think to really give us a good foundation for this conversation, I'm going to take a step back and define how I think of systems, or how we think of, you know, a system and what system-based thinking kind of entails. I think the broader public health system and the governance system attached to it is a really good example of this. So, you know, and Ken touched on some of it, but a system is really this interacting, interrelated, but yet independent components that form a more complex and interlocking whole. And these components are impacted and impact each other, impacted by and impacted by each other. And of course, there's different scales of systems, right? And there can be systems within systems. So this can get very, very complex, but it's really important to look at it within that structure when we're trying to integrate different sectors, climate science and health, and how those, which may have, you know, traditionally not interacted as strongly before, but when we're looking at climate risk within health systems, there is this need for an interdisciplinarity, transdisciplinarity, and integration. But within these different systems, how do those map on together? So when you're looking at systems-based thinking, I like to picture it, and definitely picture the public health governance system as this living ecosystem, right? It is constantly evolving, it is updating, improving, absorbing new information, right? But this kind of idea offers an opportunity to integrate and assess when new information comes through, when new risks are presented, with the understanding that not every public health system is the same. There are different contexts, there are different needs, there's different socioeconomic demographics, right? And so that has this own fluidity within this broader system. But when kind of trying to tackle areas that have been somewhat siloed, right, we need to break down those silos and support that integration, but there needs to be some planning behind that. So when we're planning how to bring in climate science risk into a health system, how can we plan out the systems from high level administrative policy thinking all the way down to a granular level of one-on-one healthcare provision with a patient? You know, I think this specific climate and health nexus, right, is particularly interesting because as climate risks are integrated and are increasingly visible, right, within our day-to-day life, it's presenting new risks and many risks that we haven't really tackled or are familiar with before, right? Shifting weather patterns, changing precipitation patterns, increasing heat, extreme weather events, rising sea levels, etc. How do those risks specifically impact different health implications? What does it mean for medical technology? What does it mean for different economic scales, vectors, right? There can be an extending period of vector presence, or new vectors and diseases are introduced into communities that have never had to deal with them before. How are those things tackled, right? And how can we be pragmatic and systemic in tackling this? And so I think within kind of the broader systems-based thinking, it gives us a good framework to tackle some of these things, right? Within it, while understanding it's highly complex.
Yeah. So in terms of, you know, what would you say? I mean, you're saying that climate change impacts on different health systems. Do you have, like, one of the things that Mackenzie and I have been working on is heat, and that heat and impact of climate change and heat on the health system. Do you have any, like, a case or an example of what that looks like? Or do we want to touch on just sort of systems thinking in development in general? So both Mackenzie and I have done a lot of international work on different development issues. So we have some examples of what that looks like in those cases. But Mackenzie, I don't know, what's your thought?
Sure. I mean, I think maybe a great example would be helpful in nailing this down. You know, and I think Gorakhpur would be a good one, right? I mean, there are we know pretty definitively, you know, heat that's going up, and it's impacting different areas more severely. So if you look at kind of the Gorakhpur region around Northeast India is very, very hot and very, very humid. And so far, you know, the human body has been able to manage this. We have different adaptive capacities that people are employing. If it's too hot at night, you sleep outside, etc. Keep in mind, this area of the world has very low electrification rate. I think the last study I saw on it was about 300 million people without active cooling systems, right? So maybe you have electricity and it's enough to power a light bulb, but it's not enough to run an AC unit. But what we're seeing is these increasing heat indices of temperature and humidity is rising past thresholds that are survivable or that the human body is able to adapt to. So if you think of 37 degrees C, the normal body temperature. If it's very humid, your natural sweating system is how your body naturally cools itself, is no longer effective when it's so humid out and when it's so hot. So where is relief that's happening there? So this is impacting across multiple different sectors. Energy demand is spiking with an infrastructure that's unable to meet it or handle these large demands peaks all at once. You're seeing the economic system be impacted through outdoor laborers, construction, agriculture, people selling things in a market, right? Taxi drivers, unable to kind of meet that demand. And then you're seeing actual health repercussions of, maybe 1 or 2 days you don't have a good night's sleep. And, I should say nighttime temperatures are increasing at a faster rate than daytime temperatures. But once you have weeks added on to each other, and it's weeks and possibly months of these high heat seasons, what is that doing to individual health capacities? What does that do to a health system that may not be ready, right, resource-wise, in terms of number of beds, ambulance capacity to pick people up if people are presenting all at once to a health system because it's so hot? That's, as we know from our current examples, systems are getting overrun. Right. And we have data on kind of more acute and longer term implications from people experiencing heat stress through things such as kidney disease, et cetera.
And we have a couple of comments in the chat box. One is early on was just a thank you for highlighting the fact of talking about the distinction between resilience and adaptation. The next one is on health systems, and if you want to go ahead and consider that one. Mackenzie. Yeah,
this was actually another example that I had was going to bring up later on, but I think it's a great comment. So it's looking at challenges and difficulties with understanding heat and extreme heat and the issues around data, proper diagnosis, and actual collecting that data from a research side. So I think data number one is really, really key. And that is forming the baselines of action that a lot of governments look at. In many developing countries, what we see is there is not a lot of robust data, and specifically on the health side. And this is for many reasons. And some of it hasn't been digitized. I've gone in hospitals and they have whole rooms of books stacked up with information and data in there, but it's on paper and it's never been digitized, right? And that's years. Yeah. You as well.
I just want to say I'm going to do a little pushback on data. Not that I'm against data. I'm a physical scientist by training and everything, but there's a lot of people who don't want to move until we get data. Yeah. And a lot of the great things about resilience thinking and systems level thinking is that you do move without data. You have to move forward. It's more, and many people have different sort of intervention designs. One of the ones that we've used before has to do with going through a process iteratively, because climate models, all of this information improves over time. Leaning back on COVID, you can see that they didn't know a lot when it started, and they still don't know a lot, but they're making decisions, they're moving forward because they have to. That's sort of where we are in terms of resilience, particularly in low data environments, which is pretty much where Mackenzie and I work. But I think there's going to be a lot of low data environments here in the States as well. Yeah, Mackenzie.
Yeah, so if I can push back on your pushback, Ken.
Sure.
I definitely agree, and I think that's a great point, and it's a reality that we're operating in. I think looking at it from a policy mandate side is specifically critical need for having data from policymakers. Yeah, is that better? Sorry, I was hearing an echo. Anyway, so the need for data is almost sometimes a comfort blanket, if you will, for policymakers that say, without data, I can't act. And there's a lot of anecdotal thinking coming through, but to design policy, and I think this is specifically and perhaps more relevant to slow onset events, right? You can have an early, a fast onset, a hurricane, or there's demanded action, there's a visible site to it. Slow encroaching heat, right, where we can project in the future, but we may not have hit the thresholds now. We're seeing these magnitudes, but it's happening over a longer stretch of time. That gives people almost a time window to go back and forth and look at. And I've seen from a governance side, you don't get a lot of movement without a mandate, and people aren't going to act on their own. So how, can you give people that ability? And I think a lot of that should be tied around data that's in parallel with current action that has to go place, because having years of data takes a long time, right? And
Right.
so how do we design those systems? You know,
This
and I
is
think
what
that, yeah.
I mean, this is sort of what I've called the good thing about climate change, and also the challenge of it. I mean, I think when you take a systems level or general resilience approach, it doesn't fit well with our sort of more complicated problem as opposed to complex problem. It doesn't really fit with our governance systems very well. And so there is question about how do you square those circles? How do you take that general resilience approach where and fit it into the budget lines? And you know, we've certainly found some methods, but I don't know if they're universal. It's more contextual. So I don't know.
Yeah. Oh, sorry, Ken, I didn't mean to cut you off. I mean, I would say I think we've seen a lot of leadership on this from the international donor community, which of course is, I don't want to say selective, but is always following funding requests and requirements, either through bilateral action or through multilateral action, right? The WHO and the Climate Health Office of the WHO pushing a lot of these agendas, USAID and its equivalent of GIZ and DFID, right? The Germans and the British, right, are funding to develop these systems, right, and to be more proactive as opposed to responsive. And I think that is a key line of helping or incentivizing governments to put in place more appropriate systems and protocols and strategies, and their own funding requirements and resource base of individuals, technology, et cetera, to be able to manage this. Yes?
So, yeah, you're noticing the question. I also just wanted to open it up more because just to see if there's anybody who wants to ask a question or even get on video. I know we're all in our best right now.
Our best athleisure wear.
Yeah.
I mean, I see a question from Helen about literature and the impacts of climate-induced displacement on health systems. I'm actually working on a paper right now on this, and that it's a climate-induced migration is an emerging topic. If we can piggyback on the data issue on that, it's been particularly hard from population and geography sciences have been looking at a lot of this, but to be able to get data surrounding that. If you get out migration, which people have moved out of somewhere and typically cross boundaries, and they're picked up wherever they're moving to, right? If it's in migration, right, they move within a country, may move somewhere for a season and move back. That's very difficult data to collect, and so that has been a challenge in really understanding where some of these movements are. If we take India as another example, you have a traditional migratory labor system, right? You have a lot of people will move during seasons for jobs. How is that changing with increasing climate events, or, you know, in the area of Gorakhpur, you see, and even if anecdotally you see people are moving and they may not be moving back, or they're staying longer where they went to as opposed to moving back. Getting numbers on that is particularly difficult, and kind of almost a data invisibility problem where these populations aren't picked up for whatever reasons, and that a lot of those reasons are tied to their socioeconomic status, what type of jobs they're in, you know, where are they living once they're in their new place, right? How does that get picked up? And there's a lot of challenges around that, but I think that's an increasingly important area to look at, because this is only going to grow, and this forced migratory patterns are going to force thinking around that, and to collect data in these areas more than, you know, this.
There's a question out there. One of the things that we were thinking about before this call, Mackenzie, and talking about systems, and somebody had asked a question prior to the call about sort of traditional methods and traditional medicine, and is there anything to learn from traditional medicine systems and our sort of the modern or scientific medical systems?
I mean, I think for sure, right? And societies have been surviving for a very long time, you know, before our modern medicine came onto the scene, right? So I think that has value. And I think there's a lot of communities, and specifically rural communities and that may be further away from health systems, or it's too expensive, or you don't have transport, et cetera, to rely on a local healthcare provider in the village or in the community. And I think what's interesting within this realm of what we're talking about is we're looking at what happens when people rely on these traditional methods. And you can probably count modern medicine within this, but when we are having these new normals that have no history, right? The increasing heat conditions that we're going to be seeing, there is not a historical memory, right, that we can rely upon or say, oh, I know how to handle that. This is a new reality and a new magnitude of risk that we don't know about. So I think that introduces a new risk of, you know, kind of traditional traditional medicines, traditional adaptive capacities, right? You know, and we have talked about floods, right? So, you know, there's a flood a couple years ago, people went through it, they understand, okay, there's another flood. We have a reference point, right? But what happens when we're experiencing temperatures, humidity, and heat indices that we've never experienced before, right? Oh, it was hot a couple summers ago, I remember this, but actually it's new magnitude of heat that we're experiencing and surpassing these thresholds that we have never really experienced before, and for the duration that we've never experienced before. And so that can almost increase or add an additional risk because we're relying on things that worked before, but they're not equipped or designed to work for this new risk, right? And I think that, I mean, it's a bit of a dovetail away from that question, but I think it opens up an interesting way to think about how we respond to some of these things.
Yeah, I mean, one of the, go ahead.
I was just gonna say where our traditional responses or our traditional adaptive capacities aren't feasible or may not be enough.
It's one of the challenges around climate change and sort of community-based adaptation are, you know, the sort of histories and knowledge about, there's a long challenge in development of top-down knowledge structures, right? And so it's how do you integrate this global information into a local knowledge stream? And one of the challenges is that this, you know, are the changes that are going to happen that are unprecedented and that aren't within human institutional awareness. You know, like in India, they're used to flood. They're in, you know, sort of cultural ingrained behaviors that are associated with flooding. True with heat too, but what we've discovered in some of our projections is that the traditional means of dealing with heat won't be sufficient. That there are going to be areas of the country that are not survivable. So that's, you know, how do you bring in how do you change that? How do you integrate these different knowledge streams in a way that that at a local level people can actually use it and something of value will come out of it? One of the ways in which traditional systems I think stand out from the science health systems is its ubiquity. You know, traditional health systems are everywhere. And I think there's something to be learned from that. And one way that I've seen that we had nothing to do with, I've just heard the story, was in, I think, Kenya, where the medical system deputized the motorcycle taxi drivers to be first responders. So something where you can think about the systems you have and how that system works, that social system and that you know, general connecting system. You can think about how that works and then how do you fit a response mechanism on top of that. We got another question, by the way.
Ken, if I can give one example and then Hentern, I'm sorry if I mispronounced your name. If maybe we could tackle that question, I thought it was kind of interesting. So to dovetail on this conversation, the example I was going to give was about the Ghana health system, and I've done a lot of work with the GHS for a number of years, specifically in the northern and northeastern regions. And so I was up there, looking at how is the Ghana health system responding to heat, and this kind of the northern half of Ghana is particularly at risk, and at risk for high heat indices as you come up to their rainy period. So high heat, high humidity, and not really any option for active cooling. And you have, talking to very rural village level healthcare providers, they talk about people coming in and are discussing and presenting symptoms that sound a lot like heat stress, heat stroke, and they're starting to get the reoccurrence of individuals coming more often than not. A problem with, or challenge with the Ghana health system, and this also links on to the data question, is how the national insurance scheme is set up, right? And all Ghanaians are covered, but they have put in restrictions or limits to what different healthcare facilities are able to diagnose. Part of this is to prevent somebody from, requiring someone to go all the way to the top to the regional health hospital, where maybe they can be treated more locally, right? But if someone is presenting in these local healthcare centers, what do you tick for what is the diagnosis so that they're covered under the insurance scheme? There is no code for any heat-related illness. And so what we were seeing is healthcare providers are marking the diagnosis as malaria, even if they gave them a test and the test came out negative. But this is a way for them, if the insurance is covering this person's visit. But there's also no collection of data. And when I talk to, administrators at the national level and raise this, there's kind of, well, we're not actually seeing heat is an issue here. And for a long time that's been correct, but increasingly, and specifically in the north, we are now in the next, even 5 to 10 year period, if not sooner, you're going to see large shifts and changes in those systems. But the government is still, without seeing evidence, is not going to collect the evidence and change the coding, and then we're not collecting data, right? And so they're still relying on a traditional memory, a traditional approach of actually heat isn't really a big deal for us here. And I think that recognition of risk, right, is kind of wrapped within this overall discussion. The Hentern's question, again, I apologize if I said your name incorrectly.
Martha sent me a message. Her name's Martha Turner, and it just came out. It looks like Hentern on the thing. Just clarify.
Okay. Yeah. Sorry, Martha. I think this is an interesting question. She says, if forward-looking private investment advisors what might forward-looking private investment advisors undertake to try and address unprecedented risks such as heat, et cetera? I think there's some interesting work done around in the insurance company. We've around parametric insurance, right? So you set a parameter, and then the idea would be that cities or a district, et cetera, if we project in a forecast that we're going to hit these parameters, they will pre-fund some of the insurance, right? So the city has funds to be able to open up, a gym, right? And that can be a cooling center for people to come into, or they can quickly hire a bunch of more drivers or pay people overtime so they have more ambulances out on the road, right? It's almost a preventative insurance metric. Or flooding, we know, oh, it's hit this marker, so we know in 10 hours it's going to increase. And that's where we have a situation. They can pre-finance some of this insurance money. But I think there comes to a point where, when are you insuring things that then are no longer questionable, right? But that they're going to happen, and they're happening year on year on year. It's not a 1 in 25-year event or 1 in 50-year event, right? Where it makes sense for the insurance company to invest in that. You know, I think that's kind of a trade-off, and some issues around the upfront financing of this. You know, is the city paying into this structure? Is it a rich donor is fronting this money up at the front, and then the city just pays premiums on it, right? How do the mechanisms of that work? We're not really clear on yet, and I think needs more almost trial and error, if you will. But that's one way. And I think maybe this can take us into a discussion on planning and kind of the infrastructure. And if you get private investment of how we can rebuild, update, make our infrastructure systems of, and this is, you're looking at buildings, transportation, resource provision, I think more inventive and definitely innovative insurance schemes, how that can be put in place to deal with kind of some of these emerging risks, which is in the big scheme, preventative measures should end up saving you money over the long term, as opposed to purely reactionary measures, right? Ken, did you have something to add in there?
No, just that it highlights how important it is to work with the systems you have. So obviously, with how most projects are organized and operated, you need the data. You need clear a way to communicate what you're doing. Yet some of the climate and resilience-oriented and systems-oriented things don't fit well with that sort of structure. So either you get that buy-in early on, or you figure out a way to map it over.
Yeah, I think you're exactly right, and I think some of this investment could be particularly interesting of supporting innovative roles, right? Can there be a role in, risk communication specialist able to translate what the data is saying to a healthcare provider, right? Or a biometeorologist, somebody who is trained in both areas, able to make these connections and to take that pressure off of a service provider, trying to understand and deal and adjust their diagnosis and their care that they're giving, right? I mean, I think those could be some really interesting ways of private investment into a system. I would imagine private investment would want a return. I'm not sure how you figure that in, but this comes into a larger question of public health being a public good. Weather forecasts are a public good. Disaster information is a public good, right? So how can we actually finance some of these systems to operate more effectively, right? As and it's not just we're juggling a bunch of risks in the air. It's not one risk falls, it's additional risks are being added to the system. How can we more effectively manage that? And I think, I would like to see more private investment in the sector, working in collaboration with public institutions providing public good.
Yeah, I'm wondering if COVID is not an opportunity. It sounds kind of rough to say right now, but it's not an opportunity to for people to become more aware of the fact that, and I've got a cat who's showing up, to become more aware of sort of inertia in systems and basically preparing for things that you're not experiencing right now, but are coming, right? So they were warning us about this, and everyone was sort of like, what are you talking about? This feels like normal. There's nothing different about now than it was before. I don't know if that's something that people want to talk about or not.
I mean, I hope at the end of the day that what comes out of our COVID experience is at the very least a reemergence of a reliance and appreciation for science, for investing in systems, for investing in appropriate healthcare, for these public goods such as available affordable healthcare access that should be to everyone, right? If you think of this again, everyone deserves to be able to survive in the climate that they're living in, right? We've created a situation where that may not be possible for certain communities and areas of the world, how as a global community can we start to tackle this? And that of course is devolved into different governance systems in different countries, you know, and then federal to state level, of course, but you know, there is a global community, and one person's actions actually can have a ripple effect and have global consequences, and systems need to be prepared. You know, not all of investigative science is a new big breakthrough. Some of it is investing in the systems and being more efficient, and maybe day to day we don't know about it, but that doesn't mean it's not working. You know, and I think communicating some of those wins and findings, you know, I hope can come out of this. You know, and if at the very least, you know, an appreciation for institutions and the structures that support those institutions are important and needed to be invested in. You know, and I think if not, I think we're getting a good case study of what happens when key funding sources are cut.
I want to jump in. It looks like we're getting close to the end of our time, but I kind of have one wrap-up question for both of you and anyone who wants to enter their thoughts in the chat box too. It might be too broad, but just what is, from your experiences, an overarching takeaway in regards to improving public health systems in the face of climate change? You know, what is the most critical thing we can consider, and then go from there to taking action?
Okay, I'll go. I think the most critical thing is improving the interdisciplinarity between climate science, climate change impacts, and the more granular impacts that are seen within a specific context that a specific health center or a health system would deal with, right? What's happening in Texas is very different than what's happening in New Jersey or what's happening in Wisconsin, right? But we can understand the risks and the projections and what that data is telling us to be able to look ahead and to build out the systems of what we expect to be seeing. This, of course, should come with additional research. There's much more research needed on the actual granularity of impact when you look at the projections, even if you look at seasonally or, you know, decadal, et cetera. That gives you a good range, but to understand what is specifically happening in a specific context, I think there is obviously much more research needed to be done, and actually to quantify some of those impacts, which can go forward and support and give policymakers some information to deal with, right? And making decisions about what's in the unknown is very difficult, and I think a lot of times climate change is a very gray space. We can quantify what some of those impacts mean at a more contextual level. I think that would be really helpful, and health systems certainly would benefit from that.
Yeah, I would agree, and just say, you know, there's some efforts now you can see in improving systems thinking in governance structures, sort of like resilience officers and things like that, where there's sort of empowering different levels of governance to see the real system that they're interacting with and how to adjust to it as it undergoes change, from climate change, from health impacts, from other things like that.
Well, thanks to both of you for those answers and for the conversation today. And thanks to everyone who joined in on the call and for your comments and questions. I'll be sending out a recording of this conversation within the week to all of you who registered, and feel free to pass it along. It'll also be found on Climate Change Adaptation Knowledge Exchange, or CAKE, so people can refer to it. And yeah, once again, this was all brought to you from EcoAdapt's Global Adaptation Month. So please visit our website and share about the work that you all are doing via a commitment. And you can always contact me with any questions you have on that. So thank you both. If you have any final thoughts, please share.
Thanks, Molly, for organizing this. Great job.
Yeah.
Thanks, everyone.
Thank you.
Bye.
Okay, bye everyone. Have a great day. Stay healthy, stay sane and safe.